It's all about educating and taking care of the community. The Waianae Coast Comprehensive Health Center has been serving the west side of Oahu since 1972, and they continue to do so during this pandemic, from free testing, food drives, to administering the COVID vaccine. Now, in fact, they're sponsoring tonight's vaccination education forum right here on KH12 at 9:30 and 7:30 on KHI. Joining us this morning with all of the details is Dr. Stephen Bradley, Chief Medical Officer at the Waianae Coast Comprehensive Health Center. Good morning, Doctor.
Good morning. Wonderful to be with you all. Aloha.
Oh, so happy to have you. And of course, very excited about the forum tonight. But before we talk about that, can you tell us about the Waianae Coast Health Center and the services that you've been providing for the community?
Yes, of course. You know, as you can see from my background, we're in our 50th year now. I can't believe it. I've been with the Waianae Comp for 27 of those years, and time has just passed so quickly, but so wonderfully. It's a unique organization. It's born from the community and run by the community to serve the community. It's a special place, and we are the largest federally qualified community health center in the state of Hawaii. We have 11 sites treating basic patients in all of West Oahu. So we cover a large area. And, you know, our mission statement basically includes three main things: healing, learning, and innovation. And we do all of those with face-to-face and now telehealth. We have a number of teaching programs, and we're innovators. We started using electronic medical records a long time ago, over 20 years ago. We were on the cusp of that whole revolution. So we've been involved quite a while and have a lot of services in our institution to deal with all of those. So, you know, the fact of the matter is that we started small. We started to serve a community that didn't have any health care and have just evolved from that. And it's really been a pleasure and an honor to have served in the Community Health Center for these years.
And of course, you're definitely continuing to serve the community in a big way throughout the pandemic. So how has COVID impacted the Waianae Coast, and how has Waianae Comp then responded?
Right. It's, you know, the pandemic hit all of a sudden. No one was expecting this. A year ago, it fell on us. And we responded, again, we're being our innovation and our flexibility as an organization. We responded much like we would to a natural disaster. We said, this is a kind of natural disaster hitting this community and a lot of unknowns, and we have to be ready for everything. So we had a marked decrease in both our demand and our ability to serve our patient base. So what we did was we had been working on telehealth for quite a while before, but the time just wasn't right. However, in the course of 10 days, we trained all our providers to use our telehealth platform and threw ourselves into that to be able at least to give a basic level of healthcare to all of our patients that needed help and needed follow-up. And so that was really important. What we did at that same time under our emergency plan was we developed a separate COVID hotline with a number that people could call in. And it still exists. It's 697-3071. And you can call in and get information on COVID. You can set up appointments for testing, a number of things. So that was set up right away. And we had testing services. So that was a pioneering at that moment. And we set it up outside of our facility proper in Waianae on the driveway with a portable, and have been doing an incredible number of tests all through the last year. And that really made a difference to be able to identify who may be positive. And not only that, but to be able to do patient contact after that, which was one of those things that was slow in starting. We got on it right away. So every positive test, we had folks that would jump right into it, call the patient, the family, get everyone involved, test other people in the family. So we got a handle on things as quickly as possible. We realized from the get-go how serious food insecurity was. And, you know, now it's become a big, a recognized problem. Even almost 50% of the state is recognized as being food insecure. We knew that from the get-go. So we started doing with allies in the field, we started doing food distributions. And we have distributed well over 3 million pounds of food to our community since the pandemic started. We also have keiki meals because we were going into the schools, and even with closed schools, we're understanding that many of our keiki, their biggest and most nutritious meal of the day was at school. So we continued that pipeline to be able to feed them, which was really important. And, we've basically honed and improved all of our processes and services for our 600 plus employees and thousands of patients. And safety has been the key. That has always been our guiding principle, is how do we keep everybody safe and how do we keep them secure? We also hosted some virtual town meetings because we thought that there was so much misinformation out there that we wanted to get access to the public and allow them to interact with us and ask questions. And so we did a series of town hall meetings that allowed us to get out there and give as best information as possible. So that's in a nutshell how we dealt with the COVID pandemic and are still dealing with it, because this is still a very fluid situation. As you know, it looked like we were basically around the curve, but now there's a little bit more of a surge going on, and so we're ready for everything.
Right. And in addition to, of course, all of those things that you were listing, you guys are also now providing vaccinations. So how has that experience been?
It's been a very interesting series because there were so many moving parts to that. But, well in the beginning, we realized as soon as a vaccine was out and safe and effective, we said, this is the key, because vaccination is the key to getting herd immunity, getting us over the hump. And so we took a very proactive stance. And so we started working with Department of Health and tried to get as much vaccine as we possibly could from the get-go. And we've given 4,000 plus doses of vaccine in arm since we started our vaccination project. So we have just been doing everything possible to get vaccinations into arms. We had some wonderful partnerships. We partnered with the National Guard, and we've partnered with the Department of Education, because realizing, everyone understands the fact of the keiki that have not been in school and all the things that affects both in their lives and in their families' lives. We have to get our keiki back in school as soon as possible. The key to doing that is protect our educators so that they can continue to do the great work that they do in our community. So we worked to do a mass vaccination pod with Department of Education, which went extremely well. And then subsequently realized that as the Department of Health and CDC were recalculating the eligibility levels for vaccines, we worked on that right away and had a pod in our brand new Nanakuli Clinic in Nanakuli Village project just before, the week before it opened officially, to do a mass vaccination there of our kupuna. And that was also a wonderful experience, and we thank the National Guard for all their collaboration. They're a wonderful organization, really came in and helped the community. And, we are at the Waianae Comp very culturally sensitive. We do things in a way that's appropriate for our community. On campus, we have a Native Hawaiian Healing Center with which we communicate and formulate policy. And so we are, again, part of our community and really do the best we can in that.
Wonderful. And again, you guys are doing so much for our community, and you're helping out this evening as well. So there is the upcoming vaccination forum. It's on KHI and KHWN. Why exactly is it important for people to keep up to date and learn more about vaccinations?
What I think is there's so much misinformation, and that even my patients still are calling me about vaccinations. I've heard this, I've heard that. We feel that education is power, and it's the power to overcome a terrible pandemic that we've never faced before in human history. So what we are trying to do, much like we did with our town meetings, but with the collaboration of the network, of your network, is to really get the word out and get information out to the public, accurate information, to allow them to get the best information, the latest information, and formulate plans on top of that. So we're really thankful for that.
Right. And again, you're going to have that opportunity this evening on K-High at 7:30 and then once again on KHON2 at 9:30. So make sure you tune in. Again, a wealth of information, everything that you need to know about vaccinations and the vaccination process as well here in Hawaii. You're going to be learning tonight. Thanks so much, Doctor, for joining us this morning.
My pleasure. Thank you very much. Aloha, everyone.
And if you do still have questions about the vaccine, again, tonight, Gina Mangieri is going to be talking to doctors and other health experts as part of our new half-hour forum that's happening tonight. The Vaccination Education Forum is at 7:30 on K-High and 9:30 p.m. KHON2. You're not going to want to miss it.